latest episode of The Pulse of East Providence with Mayor Bob DaSilva. You know, our administration prides itself in trying to use all means of communication to get the message out to our community about some of the things happening that impact East Providence residents and that make our community the best place in which to live, learn, work, and play. We utilize our website, eastprovinceri.gov. By the way, stay tuned to that page because we're making some updates and it's going to be even better than what it is today. On that page, you can sign up to our bi-weekly newsletter. There's a newsletter that we send out to people on a bi-weekly basis. Take a look at that. And of course, you can always check out our social media pages, both the city, police, fire, a lot of different departments utilize social media to get the word out on what's happening. And I, of course, use my own social media to get information out to the community. Today, on this show, which is another great way to share information with you, I have the director, CEO and president of the East Bay Community Action Program. His name is Rhode Feyisitan, and I am absolutely honored to have him here today because EBCAP, as it's known across the community, provides some incredible services to our residents, and this is going to be an opportunity to share with our community some of the great services. Thank you, Rilwan, for joining us.
Thank you so much for having me this morning, Mr. Mayor.
Well, I appreciate you taking time. I know you have a busy schedule. I always like to start my conversations with the community members by talking about where you grew up, where did you go to school, how did you end up wanting to be in this role? Kind of explain to the community who you are.
I appreciate the opportunity to be introduced to your viewers and to all the great work that you're doing here in East Providence. I'm a Providence kid, born and raised, but native Rhode Islander. Had the opportunity to go through the Providence public school system, Central High School Government Law back in the magnet days, Roger Williams from undergrad, and then some additional training certs and work in education. So a lot of my career and my time has been working on municipal issues, working with education and helping people to work to get to self-sufficiency. So we did that for many, many years in the city of Providence, then worked on the state level for over a decade, working at statewide issues, and then have the privilege of coming to this side of the Bay and doing some work here in East Providence, in the upper and lower East Bay, and the 10 communities there.
That's fantastic. And you took over when Dennis retired, right?
That's correct.
And now, how long ago was that now? Like
entering my 4th year.
4 years
Time goes
already.
fast.
That's fantastic. And we have collaborated. We have some joint operations that are going on. I mean, one of the things I'm very proud of is the health clinic that we've partnered with the East Providence School Department, EBCAP, and the city. That's located at the Sweetland House, which is located across from the East Providence High School. Tell the community what that program's all about and how that program is situated really as a way, and it's kind of evolved because now not only does it deal with mental health, but it also is a primary care clinic. But explain to the community what that program's all about.
Oh, it's just been an amazing joint venture, as you said, with the city and the school department. United Healthcare was one of our lead sponsors in helping us to get some of the seed funding and money to move that along. But as we all recognize, there's a correlation between the work we do with our families, with the school system, and being a partner as a social service agency and making sure that we can put our arms around them. So I think a lot of you were part of that norming and storming and visioning of what that space could look like. Being able to have a primary care provider just steps away from the primary building from the high school, coming into that beautiful complex that you're building out with all the wraparound services there. And we serve a function that we can be able to be that extension to primary care homes for folks that need the services. So you did mention we have clinicians right on site that are able to help support any of the needs of those high school students or anyone in the district that are looking for behavioral services. Anything from anxiety to depression to issues of suicide or any of the things that might be there that these young adults are going through and these adolescents are facing. Right down to helping with the primary care needs, whether it's sports physicals, being able to go in for primary care and being still on the school grounds so they don't need to leave or go far. And we're looking to expand that to other families in the district. So again, as they may have ear infection, strep throat, or any of the normal day-to-day things, you can bring the whole family there, get those services, minimize the time for families to be out of work, and also for your district employees to be able to come in and be able to do that too. So if they need to stop in and see us first before the school day or on the end of the day, can come in and do that. We even have wraparound services with in-house pharmacy in our main location here in Bullets Point. So again, we're just trying to make it as easy as possible for families to get really good, high quality service in all of our primary care services.
That's fantastic. And I don't think many people realize, because one of the biggest challenges today is finding a primary care physician. A lot of them have retired. My own primary care physician retired, and I had to go find someone that took some time. So residents who are listening should understand that at the senior center, where the East Providence Robert Rock Senior Center is located on Waterman Avenue at the corner of Pawtucket and Waterman Avenue, in that complex where we're building the state-of-the-art community center for our residents, there's a building called the Sweetland House that the city of East Providence put some money into. I think it was close to $500,000 to retrofit so that it met all of the requirements of a healthcare facility. And there's a lot of requirements we learned through that process. But residents can go there, and if they need a primary care physician, they can schedule an appointment, correct?
That is correct. We're actively building out those services. We're really fortunate that we're bringing on more and more providers. So again, we do have an absolute shortage in the state, and we're at a good place. Knock on wood if this table is that we're building access and being able to increase it. So again, we're opening up our panels. We already have access right now at our Bullets Point location. So again, if folks want to go to EBCAP.org, they can go or call our main number and just get scheduled at our one of many facilities. But again, the Sweetland House is going to be really great for families that are just across that bridge, walkway to come into the school. We're going to be expanding over the summer, same-day access even in that space. So as we close down the school year, we'll be able to have more access points when those young adults are not in the building to be able to do those after hours and additional services there. So we're really excited to be able to bring to residents of East Providence and surrounding communities access. So again, we believe everyone should have the ability to have a primary care provider or medical home, so that we're not just same-day access, which you can come in for the acute things that are there, but actually have someone that can grow and walk with you. We actually have hired and brought on a pediatrician for the first time in many years. We've already got an amazing family medicine practice, which means we take care of everyone in the family. But also for those that want a pediatrician, we do have open appointments now. If you're willing to come in and get those services started, right from prenatal care and walking through the life of your child to adult.
That is incredible. That's fantastic. Now, is that at the Bullets Point location, or is that?
It is. Our pediatrician's primarily there, but again, we have locations in our primary care services in the Upper and Lower East Bay, including Newport, with one of our centers, Barrington, and East Providence.
Let's talk about what EBCAP even stands for. Explain to people what the collaborative is and what it means, and mention some of the locations where they are currently located, so residents may not be aware. This program gets aired all over the state, so
Absolutely.
There could be somebody in Newport or Bristol or Barrington that don't know that these services are nearby. Can you explain?
Yeah, we're all over. I mean, our geographic catchment area, again, is the 10 municipalities in the Upper and Lower East Bay, all the way from East Providence down to Jamestown and Tiverton. We have main buildings or hubs in East Providence, Barrington, in Newport for our behavioral health primary care. But we also have in other municipalities like Warren and other areas our recovery centers, which is a big part of the work we do for those that are going through and need support with addiction issues. And then we also have Head Start, WIC programs. Many of you may encounter or interact with East Bay because of our weatherization programs. So again, helping everyday Rhode Islanders that need to help insulate their homes or make it warmer during the winter and cooler during the summer. We also administer for the state the LIHEAP program, which is our heating assistance program. So everyone that's dealing with these astronomical bills that are getting higher, we try to help in two ways: help with those bills and provide basic grants that support getting people restored or preventing them from being disconnected from services. But most importantly is helping those that are homeowners or renters be able to have adequate energy efficient appliances that are there. So again, we often when we come into a home are providing over $15,000 of free services that go into the home. That may include boiler or furnace replacements. We will go through and do an energy audit of the entire apartment, meter the refrigerators, make sure that they're working adequately, look at the appliances to make sure again that they're the best rated so we can save you some money in the pockets there. Absolutely comprehensive, soup to nuts, top to bottom, basement to the attic. We're going to see where we can insulate, support. And then our staff is, because at our core, we're a social service agency that supports families. Our team will go in, maybe being asked to come in and see how we can save you some money on your utilities. But if we see young kids there that need diapers, we have a great partnership with a program that helps to provide onesies and twosies, Pampers and diapers, right up to working with our amazing seniors that you talked about in your complex with the senior services there. We've got an amazing program that helps them to be active and vibrant, stay in their homes with our senior services. In our programs that for those that are still looking for a little bit of pocket money to be able to do those kind of services, and making sure that the mental acuity is there. We also contract with the state to work with our protective services cases. Those may be those that are dealing with things like hoarding or have some mental health issues and are just dealing with protective issues, elder abuse, any of those issues where come in and work with the state or with the municipalities to make sure that we can do it in a really caring and respectful way. Mm-hmm. So what we like to say is we're a life course model. Whether you're newly expecting, prenatal, all the way through our seniors, EBCAP has services and programs that you may be able to tap into. So we encourage you to go to our website, take a look at what's there. Again, over 30 unique programs that help people at every level of need.
What's the website again?
EBCAP, EBCAP.org is probably the easiest way to go and look. All of our numbers are there. Our programs are there and they're expanding. So again, that's been one of the challenges with all of the fiscal and municipal issues and challenges in restrained budgets. We've been able to hold the line and really invest in programs that residents need the most and that have the most impact. So we're really proud of that.
And I'm sure you're seeing it because I hear it all the time. I mean, fiscally, people are having a much more difficult time making ends meet.
Absolutely.
A lot of these programs are incredible, and I think a lot of people are not aware that they exist. What are you looking for in the way of who qualifies to take advantage of these programs? And we're going to talk about some of the programs you just mentioned, but also if I'm looking for mental health care or I need to speak to somebody at your facility in East Providence across from the high school, can I walk in? Do I need health insurance? If I don't have health insurance, can I still get those services? Mm-hmm. Can you talk about both that program and some of the other great things you talked about with LIHEAP and your home weatherization programs and things like that? Can you talk about what the requirements are for you to meet those thresholds?
I would love to, because I think, again, we don't want to just be one of the best kept secrets. We're doing so much in the community. We pride ourselves on giving really good service that's respectful, that's mindful, and meeting people where they are. Mm-hmm. So that's why we love being able to have a footprint across all 10 of the cities and towns in our area. Just a general reminder is that these programs, most of them are free or at no cost. We are a federally qualified health center, which means that we take people of all needs. We have sliding fee scale for those that are working but are still struggling to meet ends meet, or maybe in that kind of area where you make just too much to qualify for some programs but not enough for others. Our staff prides themselves on trying to figure a way to make sure that you get care. No one should have to worry about basic needs, and that's what we pride ourselves on, trying to figure it out. If we don't administer the program, we're going to help to try to figure out how to get you connected to someone that does. Again, even with the large amount of programs we don't do everything, but if we don't, we know who to connect you to. And so again, what we really wanted to do, and you hear this term, no wrong door, we pride ourselves on trying to be that. We don't want people to have to go through hoops. We don't want you to have to call 8 different places to be able to do that. We've got great partners statewide that do some of that connecting. As a CAP agency, many of the calls come to us, but yes, you can absolutely come on in, meet with some of our reception staff. On our website, you will see program listings that will give you direct numbers to people so that you're not just going through the switchboard. But if it is complex, or if there's something around your public private health information, then we're going to connect you to the right people so that's done in an appropriate way. Mm-hmm. So it may require you setting up an appointment so that way you're not having those conversations in a hallway somewhere. And we just don't want people to have to wait. We want people to be able to come in, easily access services, get in and out. We're all busy, as you mentioned in the beginning, but we're going to take the time to walk with you, hold your hand if you need it, and try to give a real warm handoff to the program and the staff that's here to do those services.
Now, the other thing you have that's, I was there for the ribbon cutting some time back, was the pharmacy, which I think is a great resource to people in the community. Explain the pharmacy program you have, and is it more cost effective for people who are on a tight budget? How does that work?
You're going to get good rates there. I think it's one of the things, again, when we talk about putting our arms around and making easy decisions for folks. We work with an awesome in-house pharmacy, Genoa Pharmacy, as a partner. They're in 3 of our locations where we do our primary care. So you'll see those patients, I think they really love it. You go from meeting with a provider, if you do need a pharmaceutical or need a medication or a script, you can go right from being examined and go get it filled right in the pharmacy in the building and leave with your medications if you want. Or because we're in your local communities and neighborhoods, you can come and pick them up when you're ready, and we even have mail delivery options with that. So again, we're trying to make getting your health care, getting your needs met as easy as possible. So folks that utilize it love it. Again, you can also, we've got partnerships with the big chains. We do all of that normal work, but folks that can just, again, walk from one waiting room right down the hall and get your scripts, talk to a pharmacist right there, really love that program.
What's the address at the Bullocks Point Avenue location?
We're at 19 Bullocks.
19 Bullocks, which is, it's kind of situated, if you go down Pawtucket Avenue, right, the one-way section of Pawtucket Avenue, and Bullocks Point Avenue, it's kind of right there, right?
We're at the bottom point between the housing high-rise that's there, and then Rhodes is at the end of that street. So folks that love our Rhode Island landmarks, but we're Pawtucket Avenue, we're dead square in the middle.
Right. It's a great facility, and you guys are doing good work. What do you think are some of the biggest challenges people are facing in East Providence right now? What do you see coming in the door? What's the biggest ask from our residents?
And EBCAP is dead in the middle of that space. For us, the top issues that are always emerging, we're always trying to keep our eye on, are folks coming in trying to deal with food insecurity. One of the things we haven't mentioned to this point is we also run some of the larger food pantries in many of the cities that we're there. Absolutely free of charge. People can come in. We have scheduled appointments and times, again, so people are not waiting. If you need an emergency food package, we can do that, and schedule that for folks if the operating hours are not where people need them to be. But food is high on that list. We expect it to be a little bit more challenging with the conflicts that are going on, with the strait being closed. We know that we expect in the fall that food prices are going to go up. We're all going to see that. Fuel is already high. So we work again in our job training and readiness programs. Another area that we hadn't touched on is not just meeting people that need basic needs, but getting people to self-sufficiency. So we do adult basic education, GED training, workforce development, again, to help people to get skilled up, retooled, or come back into the workforce if you're there. The area that folks are also, again, housing. We have a limited housing stock, but we're constantly renovating, as we had talked about, looking for placement and getting people in that are below the poverty line or have issues with the high rents that we're seeing in the state. And then the area of, again, access. I'm so happy to be able to say that we're opening up spots again, and it's going to be a real help for our local communities to be able to find medical homes and places right here at a local health center. And if I could just mention, I think some people don't always understand what that means. Well, you've got a sliding fee scale, or you take people with all coverage. We do. But it's great quality service. So again, if you hadn't found your provider, we would offer that opportunity for you and your family to come in. We've got an amazing volunteer board, and I can say 90% of our board receives their healthcare services at EBCAP. So we've got bankers that are part of that group. We have lawyers, we have attorneys, we have folks that are at high levels of income in other places that they could get their services. They've got coverage, and they're getting their services through our health center because the care is top notch. Our physicians are amazing.
I think that's incredible. I think that's something that is lost in the community. People don't realize that EBCAP provides primary care, and I really want to get the word out to our community. I plan on hopefully sitting down with the school department and really trying to educate our student population, our parents, our families, that EBCAP is there to serve the student population of East Providence and to be a primary point of contact if they need mental health services. One of the things, I remember when we first started talking about partnership with EBCAP, the issue came up that children, immediately after the pandemic, children were dealing with stress differently, and they were having a lot more stress in the school and at home. And they would meet with their school counselors and their school psychiatrists, but then to schedule an appointment for them to go see somebody outside of school was taking up to a month because there just wasn't availability. So when we saw this, we reached out, you know, I worked with Superintendent Sandra Ferrand. We reached out to EBCAP and we said, look, we've got this great building that's being underutilized directly across from East Providence High School on a campus where we're going to build a community center. How wonderful would it be if a child is centrally located, if a child facing crisis or mental health crisis would get a referral from the school psychiatrist or the social worker at the school and have that child be able to meet with a professional immediately. So that's what we're trying to, that's the end game of that relationship, is to have services available. But then you've expanded upon what you do with that primary care component, which I want people to understand. I hear it all the time from people, and this is primary care for people of all ages, correct?
That's correct.
So I just want people to understand when they're watching this that EBCAP provides primary care services, first-rate physicians and doctors, and to provide you your health need services that you require. And we want them to come and use the facility that's right at the senior center. And what we hope is some of our seniors who go to the senior center on a regular basis will now have their primary care nearby. They don't have to go far. And once that community center is up and running, one of the components is that we want a health monitoring component in that community center. And we went out to RFP recently. We're waiting to see how that all works out. But we want people that visit the community center to know that, hey, I've got a doctor right here if I need to stop in and you know, go get myself checked out. So that's all great. That's good stuff. Why don't you, I don't know if you can do it off the top of your head, but maybe can you mention some of the locations across the East Bay where people, you know, maybe they could be living right next to it and not know that it's there. What are some of the physical locations across the East Bay? Can you mention those?
Yeah, so again, we talked about our location here in the city of East Providence, our hub here at Sweetland, in Sweetland House here. We're going to be expanding access there, doing some more work. Our Bullets Point location again on the same roads with Rhodes Pizza, beginning Pawtucket Avenue on that one way that's there. Also, if you are connected, because we're all interconnected in Rhode Island, we can get to Newport relatively easy. We're in the CCRI area there. We've got our Head Start and our health center that's there. In the town of Warren, we have one of our recovery centers. We have another recovery center in Newport. And then we also have a lot of our wraparound services are right here in Bullocks for those that are here in the city of East Providence. That's where you're going to find our WIC program location. You're going to find our food pantry. Our weatherization services, again, service everyone in the upper and lower East Bay. So we provide that for the entire catchment area, right down to Little Tiverton, Little Compton, Tiverton, Jamestown, Newport. Those are our primary hubs, but we'll also go to people. So depending on the program, if you've got folks that are shut in or have medical issues, we make sure that we've got portable scanners. We'll come in and scan those documents that you might not be able to get to. We've got notary services on all of those locations. So what we're trying to do is make sure that you find a location that's best conducive to you. That's why we push the website so much. You're going to see all of the locations in the buildings that we have that are available for you to be able to come in. So you're going to an area that's most convenient to you. And again, if you're having difficulty getting to us through our case management, our services, we're trying to figure a way to get to you. So we're going to make access as least of a problem as we can make it. So that we're meeting folks. So again, don't want to give bad addresses off the top of my head, but go to our website.
But here's what we're going to do. I'm going to ask our friends at PEG-RI to put your website at the bottom of this video so that while people are watching it at home, that website will always be there and they can hopefully go in and check it. And once again, for those visually impaired who may want to hear it, what's the name of the website?
It's ebcap.org, ebcap.org. It's also, we just have updated and put a tremendous amount of resources in updating the technology so that it's consumer friendly. For those that do have vision issues, again, it's fully adapted for all of those resources. So again, you can come utilize that, change fonts, do anything that you need to. We're working on changing and updating our translation on it so that you can go and view it in multiple languages. Wow. But if you call in, we have access to our language lines and interpreter services. So again, you'll be able to speak in your native language, find availability so that there are no barriers there as well.
You know, one of the ways that we interact, the municipality here, my administration has interacted very strongly with EBCAP has been through the health equity zone, which is under your umbrella, right? And they've done a lot of incredible outreach to the community and provide some services. Can you just share with the community what the concept of the Health Equity Zone is and how that's going?
It's a great program. It's part of my traditions. One of the programs I helped to establish when I was back at the Rhode Island Department of Health. Now, many years later, there are many municipalities across the state. And the whole genesis of that program was, again, to be local initiative driven. So community needs assessment, understanding from the local municipalities. So each HES will be a little bit different. We are the backbone operator at EBCAP for East Providence, Bristol, and Warren. And then we have partnerships with the HES in Newport. But again, each one of the projects is different because we've talked with community stakeholders. So as you know, some of your team are part of those HESs. We're in many of the buildings and libraries. But it's understanding from the communities the things that they need to have healthier, productive communities that focus on the things that are important to them. So a lot of the work we're doing currently is around food access and making sure that they're not food deserts. Some of the work we're doing is because, again, we're in the beautiful ocean state, but many of our communities are below sea level or starting to have issues with erosion and environmental issues, so they're doing work there. And even some of the local issues is looking at the Monroe Bridge and looking at issues like suicide prevention and some of the issues that you've raised, and I know it's been important for you. Is this how we work with communities to make sure that they can have the highest optimal life outcomes? And so every project is different and it's really tailored to the local community. But as a backbone organization, we are a convener of other resources. So we're the convener of conveners around health, wellness, connected with our state assets at the Department of Health and the Executive Office of Health and Human Service. And those programs are constantly updating what we can provide and put our arms around as well.
Well, look, I appreciate the work that you do, and I think what the community should get out of this interview is that EBCAP is there to provide or try to help provide services to people at all stages of their lives. Prenatal care, which is incredible, all the way to elder services and everything in between. And we really hope that people take advantage of the primary care services at the Sweetland House across from the East Providence High School. We hope that our student population becomes fully aware of the mental health services that are provided there. I just got the 2-minute warning from the cameraman here. Steve is doing a great job. Steve, great job on the camera today. I will say this, it's been a pleasure speaking with Director Rilwan Feyisitan. Yes. And I'll ask you if there's any last things that I may have missed that you want to share with the community before we sign off. And
yeah, please come and look at our website. Again, all of our programs are listed, our services are there, but I'll put a shameless plug in the next 2 weeks. We're having our annual gala. That's also happening down at the Atlantic in Middletown. The website will also give you opportunities to look at not only our services, but for the gala, our silent auction. So there are many great things that you can do to continue to support the work we're doing. So it takes a tremendous amount of resources. We've got almost 500 employees that are doing this work in these 10 municipalities. And we are always looking for volunteers and folks that may want to give some of their time to give back to their community and their fellow townies and others that are here. So please look and see how you can connect with EBCAP and be a part of the amazing work that we're doing.
Thank you, thank you. And Rilwan, I want to thank you for taking time to come speak to us today. And for the people in the community who just had the opportunity to hear about some of these great services, don't be afraid to take advantage of it. Don't be afraid to look into these services, because oftentimes people are in need, but they don't realize that they qualify for assistance. There's people out there willing to help. With that being said, thank you for joining the Pulse of East Providence, and tune in next time where you get to learn about all the great things happening in our community. Stay well, stay safe. We'll see you out there.